I'm asking Jordi Vila, our microbiologist expert in the AMR DetecT project, why rapid detection is important for hospitals, why they should be implementing in the diagnosis pathways rapid detection.
Well, it's very important because that will help us in administrating the right antibiotic for an infection. If you detect if the bacteria has a mechanism of resistance, then you can select the right antibiotic. And that impact in the hospital is due to the fact that if you give the right antibiotic, you will contribute to the decrease of antimicrobial resistance and also to decrease the cost of the use of wrong antibiotics. So I think that these are the two main impacts of the use of these devices for the rapid detection of antibiotic resistance in the hospitals.
And how do you think patients will like this new type of testing, the rapid testing? Why is it important for them? How would you explain to patients what is their benefit from this rapid tests?
Well, it's known from the scientific literature that the mortality is associated with inadequate use of antibiotics or a delay in the implementation of the right treatment, mainly for pneumonia and for sepsis. So having this information, this rapid information about what is the bacteria causing the pneumonia or the sepsis and the mechanism of resistance of this bacteria, again, we can provide the right antibiotic to these patients and probably to decrease the probability of mortality. Because as I said, there is a link between a delay in the implementation of rapid implementation of a right antibiotic and the mortality. So this is the main advantage, is the recovery of the patients and the decrease of mortality.
We also believe that the rapid tests will change the diagnosis pathways in the hospitals. And where do you see the major changes will take place? What hospital management has to do to really implement these necessary changes?
Well, I think that we have mentioned that these are rapid tests. So what the focus of the implementation of these devices is for to replace the conventional routine that we are currently using, that implies hours or days in order to get information. In minutes, using these devices, we can know if a bacteria has a mechanism of resistance or not, and that is the main point, because you will replace a tool that takes time to get an information or to get a result with a very rapid test. And I think that this an additional value of our project is that we want to perform the application of these tests directly from the clinical samples. Most of the mechanisms of resistance that we are currently using in the lab are detected directly from bacteria already isolated. And we are trying to provide if our devices can be used directly from clinical samples. So in this case, we also will win time, because you will go directly from a clinical sample that has arrived to the lab, and you cannot stay or wait until the bacteria is growing. So this is a very important additional factor that I think that if everything is right and we expect the results that we will obtain, I think that we will be a high throughput in the analysis of the diagnostic of clinical microbiology.